Hey everyone, what's up? It's Dr. Charlie Johnson, physical therapist. And did you know that many disc problems actually love to bend and lift and twist? And actually doing so repeatedly can result in very rapid relief, improvement in function, and just healing in general. Now, this is opposed to bending backwards, which many people with disc problems have been led to believe is the best thing to resolve pain, right? We'll do lots of press ups or cobras or back bends, but I can't tell you how many people actually keep themselves from healing because they do what they think. They do what they've been led to believe is best for them rather than allowing themselves to tune into their own body and finding what's going to work best for them. So, in this video, I share with you a live interaction I had with an individual, and we were able to see an immediate change in his ability to move and function after using a forward motion for his disc problem, not a backwards motion, which was actually, again, keeping him from getting better. And the cool thing is that you can apply this scientific method to exercise. I call it hunting for motions, this test, treat, retest process to identify the one motion that's going to be best for you. Maybe it's bending forward, maybe it's bending backwards, maybe it's moving one leg, maybe it's moving the other leg. So it's a little bit beyond the scope of this video, but I wanted to post this video to kind of challenge the traditional narrative that if you have a disc problem, you need to bend backwards and that that's good for you. When in actuality, it might not be good for you, and you might actually respond to doing the opposite. And so using this process, we can make decisions based off the data and what works for you versus what you think, what you feel, or what you've been led to believe is going to be best. Oh, and real quick, if you're not sure as to the cause of your problem, maybe you have a disc problem, maybe you have piriformis syndrome, maybe you have something else, check out my Better Than an MRI DIY diagnostic guide. You can actually download that above for free.
When I try to do the lay on my stomach and kind of keep my hips glued to the ground but
Yeah,
push
yeah,
up,
push up.
that is painful.
That's common though.
Okay.
So what you're dealing with there is like a belief system that a lot of people have for good reason. If you have a disc problem, these cobras, right, are supposed to be like a good thing for you, right? These
Right.
press ups. So this is a disc protrusion,
Okay.
and they did a functional MRI, so a dynamic MRI, where they
Okay.
looked at the effect of extension on the disc protrusion, right,
Mm-hmm.
versus flexion. And actually, what you can see in a lot of cases is contrary to what a lot of people believe out there, is that extension can actually cause more of a bulge, where flexion, if intact, can actually cause a reduction of it.
One of the nights I was just having a tough time going to sleep, I got like on all fours, right? And I
Mm-hmm.
did slowly started to do the child's pose, and
Yeah,
I just
yeah.
was like there and I was kind of moving it like this, my hips, and that gave me some relief, and I was flabbergasted by it, like the child's pose kind of thing, and then I was able to go back to bed.
Yep.
Um,
Good. This is again just a picture of a live MRI of them checking out the size of the holes in the spine with dynamic bending forward, just being neutral, or bending back. But again, this
mhm,
is another case where a lot of people are like extension. That's great, dude. If you have a pissed off nerve, and your
mhm,
nerve is being compromised and potentially compressed or irritated,
yeah,
that's what bending backward does potentially more to that thing.
yeah,
You already have a disc that's taking up space and making this hole or space for Raymond smaller than it is, or it is normally under
mhm,
normal circumstances. And then as you bend back, you cause even more stenosis or narrowing of the holes where the nerves exit, and they're already narrowed because there's a disc taking up space in there. And so this is sometimes where like the backwards motion can really backfire for people.
I'm hoping today that you and I can go through the movement thing, and then you can tell me like which ones to start doing or not. Like one part of my brain, right, from hurting my back for years
Mhm.
ago, like that, I know the PTSD of it or whatever,
Yeah, yeah, yeah.
but is like, if I do the child's pose, is that gonna make it bulge even more and like send like all these nerves like spilling out, like, but I'm hearing what you're saying is that if I'm not experiencing pain, it's probably a good indicator that it's a safe motion.
The only reason you have that belief is because of what you were told. Go to a yucky motion. What's one yucky motion you could do right now where it's not going to set you back if you do it, but you can notice some symptoms?
Uh, this one.
Okay, give it a number, 0 to 100.
Let me just. So this is probably a seven, six
Okay,
or
got it.
seven.
70. Okay, now go ahead. And what I want you to
Okay.
do is go and just do 1 rep of this kind of child's pose motion. If you don't want to round the spine a whole lot, that's okay. If you want to round a little bit, again, Lots of people with disc problems actually do okay with rounding their spine. You listen to your body though.
I can really get into this fine.
Okay, so hold that. Let's just do like 3 20-second holds.
Okay.
So now I'm just making up a prescription. It's like I'm giving you the medicine right now, and we know
Man,
the
I'm
medicine
so
isn't making
excited
you.
if this works.
We're not making you throw up, right? By giving you a yucky medicine, right? So we know it's safe. At least there's no adverse reaction to it.
Yeah, this feels kind of good. Like it's loosening up my lower back a lot.
Yep. So now come back on up to all fours.
Okay.
Good. You're okay?
Yep.
Go again. And again, you listen to your body. You don't push through anything that's yucky. There, that's different.
Oh, let's try that. That's wait, just I felt it a little bit. Yeah, I feel it.
Well, remember that's probably less yucky, I would imagine, because when you cross your legs, you might go into a figure 4, and that's your yucky motion.
Maybe yes.
See what I'm saying?
You're right. You're right. Yep.
So I get what you were trying to do there. You're trying to find some comfort, but it kind of goes into a leg crossy position, which might be a little yucky. It's probably okay if you spread your legs a little bit like that.
Yeah, that's.
Yeah.
I'm even getting deeper into the hip, and I know my hips are tight, so maybe it's like a double. This could be double medicine.
Yeah, it's fine. Again, you just don't go by what you think or you feel or what you believe to be good or bad about the motion or what you've been told. Just say, does this feel safe? Does it feel yummy? If so, cool.
Yes,
now come
and you
back
know
on
what?
up.
One of the nights when I was struggling to sleep, I just got in. I literally had one leg on the ground, and I had this part on the couch, and I slept for like 20 minutes because that's the only way I could sleep.
Yeah. All right, so go ahead again.
Okay.
We'll do last one for 20 seconds or so.
Okay.
All right, man, come back on up.
Okay.
All right, now you go back and what do you do? Remember, put this in process mode. Don't put this in your problem solving mode.
Okay, figure 4 now, right? The same way, retest.
Yeah, exactly, man. And we're just going to see what happens. So now we just look at the data and we let the data tell us what to do. So now we just say any answer is fine, same, better, worse.
That's stupid that's a little bit better. I don't. It feels a little bit better. I mean, it went down by a 1.5 points. Like feels like a 5.5, or I felt like I was even able to get this up here easier.
That's the process. So you tested something yucky, figure 4. It wasn't so yucky that it made you like, oh my gosh, I can't function kind of thing. I just felt it. Okay, great. It's testable. Then we treated it. We treated it using a completely different paradigm, not based off what you think or you feel or what you've been led to believe about disc problems. We just said, kind of telling me backwards is yucky. And so what's the opposite of backwards? Forwards. And well, you kind of explored some forward motions and you actually said it felt a little bit better. So why don't we start there? Child's pose, something like that. Then
like for the next week, right?
Yeah. So then you moved into it and we retested and immediately made you feel better. Not all better, but let's just say if you went from a 70 out of 100, if 100 is the yuckiest, it went from a 70 to maybe like a 50 or something like that.
Yeah.
Great. Yeah. So we know it's safe. 2 criterion. We know it immediately makes you feel better. A motion that is good, doesn't have any adverse reaction, and makes you feel immediately better. It's a win, at least in the moment. The light bulb works. Now the question becomes is, what will it do if we compound it over time? So now we slap a prescription label on it. Okay. The label says, a dose, frequency, and time. It says how much, how often, and when. How much? I would say we just did it there for like 3 20 to 30 second holds. That was it.
I can do this in between my sessions today. Like
correct.
I have 10 minutes. Yeah.
Yep. And then how often? Here's what I would say. Be careful because here's the psychology of this. The psychology, I can
know
see
what you're gonna say.
Yeah. Okay. I don't even know if I need to say it then. The psychology of what's going to happen right now is you're going to leave this call being excited, but then you're going to be like, oh, 1 ibuprofen? Why not the whole bottle?
Yes.
And then before you know it, you're like laying all over the place. So I get it. I hear you. You have to trust me.
I will.
30-second holds, 20, 30-second holds. It's got to feel safe. If at any point, all right, it feels yucky, there's another motion we can plug into the scientific process to find and test for you. Don't be glued to it emotionally or anything.
Okay.
I know it's harder. Easier said than done. Okay? Second thing is how often? I would say 2 to 3 times a day. Two
Okay.
to three times a
Like
day. So,
breakfast, lunch, dinner kind of thing?
yeah, or final element, timing. When are symptoms at their worst?
Morning and
Morning and
at
night.
night.
Good. So I'd be doing it right in the morning
Mhm.
as a tool to help you, and right
Mhm.
before you go to bed
Mhm.
as a pill. Think of movement as medicine. If you had a
Yeah.
headache at 5 p.m., you wouldn't be like, well, I'll just take it in the morning. You'd be like, I'll take it at 4 o'clock, at 4:30, at 5 o'clock, right? So time it appropriately. So I'm giving you a dose of 20, 30-second holds, 3 reps, frequency of 2 to 3 times throughout the day. I would do one in the morning, one before you go to bed. And if you want to put the other one somewhere in the afternoon where you're like kind of
Mhm.
sitting for a lot and you can't get out of it, that's fine.
Yeah. Okay.
That one motion, if any time it becomes yucky over the next 4 to 7 days, you don't do it. As
Okay.
long as it continues to feel safe, then we look back at your weekly tracker, your trend after the week. Because remember, you
Mhm.
can't manage what you don't measure. We're measuring this
Yeah.
weekly, right? To make the decision based off the data of if better, you do not change it. You will want
Okay.
to because you'll say, what's next?
I gotta figure out the
Not
next thing. Yeah.
that's what you'll want to do.
Yeah, right.
There is nothing else to do because you're getting
Yeah.
better. Okay.
Okay.
If same, we can change it. We can go testing. We'll play the game again, hunting for motions. If
Mhm.
worse, very rare would that happen. And by the way, you should stop if
Mm.
something makes you worse. If worse, we'll talk about it, but I'm not concerned about that at the moment.
Okay. So just this motion 2 to 3 times a day, 30-second holds, or morning and night, and then maybe sometime into today. And then if it's improving, keep going with the
After the four
same
to seven
thing.
days, if it's
Yeah.
improving, yeah. And when I say improving, improvement is objective. It's not subjective.
Hmm.
This is where people go squirrely. They say, I think I'm better. You're better because it's
Yeah.
sunny outside. Okay.
Yes.
Look at the
Yeah.
data.
It's fair. Totally.
You got to look at the data. Let the data drive decision making. What is the data on your weekly tracker? You look and you go back and you record these yucky
Hmm.
motions and your pain trees. You look at the overall kind of, okay, am I better? Look at the numbers, not what you think or feel. And
Hmm.
then if better, you don't change anything. You go another 4 to 7 days.
Hmm.
If same, we can change it. We can go hunting for another motion. If worse, we definitely got to change what we're doing.
All right, so how do you apply this process to your specific symptoms? Well, step one, find a motion that's a little bit yucky. Then what you want to do is you want to try on a motion that you've been led to believe is valuable for you, that ideally feels safe, feels yummy mentally and physically, and then try it on, take a bite of it, and then retest to see if it immediately improves your yucky motion, if it makes your yucky motion less yucky. If it does, then that motion could be the motion for you. And we want to again find the one motion that you can do to solve the problem. And we do it through this test, treat, retest process. And then we can slap a prescription on it, just like we would if we were getting a medication. It would have the dose, frequency, and time. Go ahead, identify what that might look like for you. It's going to vary depending on the motion. And so if you want some help, though, finding the one motion so that you can heal naturally, click the link below to work with us, apply to work with us, follow instructions then to submit a detailed case review. I'll review your case personally. If I feel we can help, then obviously we'll chat about that. If I feel like I can't, then I will just let you know. So hopefully that sounds fair. Thanks so much for watching, and let me know what throughout this process did you find that was helpful? Was there a motion that you've been doing that you tested, treated, retested, you plugged it into the process, and you found was useful? Or maybe you discovered that it was a waste of time, or maybe you discovered that it made you worse. It made your yucky motion more yucky, and it's actually keeping you from healing. Either way, let me know in the comments. Thanks so much. Chat soon.